There we go.
All right.
Go ahead, Emily.
Let me start again then. As we began to look at how we would approach the strategic plan, the first thing was to think about
who would compose the group that would be responsible for proposing this to our organization. And we ended up with having 4 board members and one former. So we felt like we had a very diverse group, that some were very new to the board and others had been on for quite a while. Then we looked at who would guide us, who would be a good leader, how we would go about approaching it, and looked at various sources. And we were fortunate to have a grant through the Charlottesville Community Foundation, and they had access to provide us with Catch a Fire, which is a group that we could look into what they had to offer. They had experts on there that were volunteers that were interested in reaching out to the community to help the community. So we began to look at what resources were associated with having experience in strategic planning, and we ended up with just a tremendous person that did the leadership for us. His name was Yagev, and he was actually based in Israel. But we were doing everything by Zoom at that time anyway, so that just worked out fine. And Yagev led us through the process of strategic planning, but he certainly had us working very hard as to contribute. You know, we were providing all the information, and he was like the facilitator and the leader to challenge us with questions. But we have, we went from there with working with Yagev from about January through June, and we were pretty much on our own after that. But it was very helpful having a leader. And when you think about having a leader or a facilitator, that's a big conversation that you want to have as to who would be helping us to guide along the way, the path that we were going. Next. Okay.
All right, I think we talked about all that, right?
We talked about meeting.
So one of the first exercises that that we went through was we started our little assignment with the 5 of us in our strategic planning working group by being asked to answer the question, what if our village shut down? And what would that mean for our community, for our members, for other individuals in our community, our volunteers? And this question and exercise, it really made us think hard about our core reasons for our village's existence by focusing on the impact that we really have on people and the larger community. And we each individually had we had homework assignments and things like that, and one of those was to individually answer this question, and then we came together and discussed it. And while I'm suggesting that you kind of start your strategic planning process by thinking about it this way, because it really did change our perspective, because it was in a way a little eye-opening, because I think one of us said that, well, if our village shut down, my neighbor would die sooner, and those kinds of things. So it really got us thinking about the impact that we can have on a community. And the next, it also helped us to then rethink and then ultimately restate our purpose, or as a lot of businesses and other organizations, and probably some of your villages, and I think we did it at first as well, call it a mission statement, or purpose or mission statement. And so that was our next assignment. Was we restated our purpose again to unite again around what our village's purpose was, so that then we could move forward and begin to do the kind of hard planning work. And after crafting our purpose statement, we then spent a couple of weeks thinking about and crafting what we called a dream statement. And this was really trying to think 10, 12, even 15 years into the future. So opening our minds to different possibilities, and then describing in what our village, LOWLINC, what is our village like, 10 or 15 years from now? What is it like? What's it doing? And then we came back together to decide on what this dream state was for us. And so the idea of coming up with a dream first, and then working on planning how you're going to get from where you are today to that dream state 10 years down the road, really helped inform our thinking.
Excellent.
And so I'll share our purpose was that we believe having choice, control, and connections to others transforms the lives of older adults, and that our village enables older adults to be healthy, happy, and connected on their own terms as they age. And our dream, Emily's going to read our dream statement to you, just so you get a sense of how we viewed where we wanted to be in about 10 years.
Our dream statement
Our dream statement
is a bit longer than our purpose statement, so therefore we thought we would just go ahead and read that to you. And it is: through innovative programs, technology, and community partnerships, LOWLINC will be viewed as a leading nonprofit volunteer service organization in our community, giving older adults choice and control to live safely and independently in their homes, with friendships and connections that bring purpose and joy. We will be a catalyst for new villages in our region, pioneer the use of new technologies to connect older adults with services, healthcare, and social engagement, offer a range of transportation options for older adults, and serve as a trusted resource on aging. We will explore partnerships both in the Lake of the Woods and outside our gates, and we will foster diversity, equity, and inclusion in all our volunteer and member programs and activities, including access to membership, thus enriching our entire community, both inside and outside the Lake of the Woods. And as we were saying, to get to these statements, both the purpose statement and the dream statement, Yagev had us writing. We had homework to do every week, and part of it was writing what we individually thought our purpose was and what our dream was, and then pulling that together at our joint Zoom meetings that we had established to cross the time zones from Israel to Locust Grove, Virginia.
So then what we really needed to do, so our now that we had, as a small strategic plan working group, had sort of decided on what our new purpose and dream statement was, well, it was now time to really do a little bit of a reality check on that, because that was just our small group. And so we took our draft purpose and dream statements to our board of directors, and we spent about a half a day with our board and several other village volunteers and leaders from our committees and different programs. And we spent a day or half a day discussing, reviewing, and revising those so that we could all agree on and unite around these purpose and dream statements for the future. And then our board officially adopted this revised purpose and dream statements that you see here, and that's in our strategic, or that we read here, and that's in our strategic plan. Well, that actually was probably about 2 months worth of work, but that's not really much of a plan, is it? So now we had to do even more work to try to figure out how we're going to get from where we are today to that achieving that dream. And so what we worked on next was identifying and deciding on main areas of emphasis that would affect our ability to achieve the dream. And these areas of emphasis ended up becoming our strategic plan's goals that we settled on. And our Yagev, our consultant, took us through several different exercises, but one kind of interesting one was he showed us when we were talking about technology and trying because we had that is one of our goals and is one of our areas of emphasis, but that while we were discussing that, we looked at this picture, which is a picture of Fifth Avenue in New York City on Easter morning in 1900. And it's filled with all sorts of horses and buggies. And there is one automobile there, and that's the little dot that you could probably barely see circled in red. And then we looked at another picture, and this is also a picture of Fifth Avenue on Easter morning, but this is in 1913. And can you see the horse? Yeah, there's one horse in this picture, and the rest is all automobiles, of course. So this was really just to highlight, in just a dozen years, there was massive change in technology, especially and transportation, and we were trying to think 10 years in the future. And so this just kind of highlighted how much change, particularly in the technology arena and perhaps in this case transportation, can happen in the time frame that we were looking at to develop a plan. So this was all, of course, intended to keep us focused on the future and envisioning possibilities and potential areas that we really should think about and be prepared to act on and use and incorporate into our village's strategic plan, and of course our potential future services and activities and programs.
We did a couple of added sessions to expand our knowledge base and to get together with our leaders. One of the things that we did that included both the team that we were working with, as well as all of our board members and our chairpersons of our committees, was a SWOT analysis. So many of you have done these already. You know that you're looking at the strengths and weaknesses, both of internal and externally. And, some of these things Steve has already mentioned, such as our location. We're rural. So that's, we had to look at that. And, as far as strengths, for example, there's advantages of being rural, but there's also the threats with that location and the resources, and particularly with our particular village, our downtown area of Orange County is quite a ways distance from where we are located at the Lake of the Woods at the northern part of the county. So we were looking at location, we were looking at population. We knew we had about 30%, 30+% of our individuals here in the Lake of the Woods who were considered in the older adult range. And those are the kinds of things that we were looking at, as well as, you know, that factors into where are your volunteers, where are your retired people, what age group are you looking at? We had that information to just go through it and remind ourselves, what are our opportunities and what are the threats? Another threat that we had is that we are a gated community. So whenever we plan something, we're also thinking about getting guests in through the gate. We're very much open and interested in what's going on in the external environment. We're involved in, we have committees such as the External Affairs Committee, and we're very involved out in the community, but we knew we were, you know, we wanted to explore and see, you know, what additional might be out there. So those are some of the kinds of things, if you do a SWOT analysis, you'll come up with. And we certainly had the opportunities with the having the village environment and the activities that we have within the lake. There were many activities and lots of people that wanted to volunteer, and that was looked at with a needs assessment from the very beginning before the village was started. So we did the SWOT analysis as one of our tools for strategizing and helping us to identify our strengths and weaknesses. Another thing that we did was the focus groups. And the focus group, we had about 12 people that came to that, and included both members and volunteers. And we had a leader, in fact, our former founder and one of our former board members led that group. And we went over our dream statement. Her strategy was to go over our dream statement with them and have them underline certain things that they liked about it and other things that they had questions about. So that was a good tool to use, you know, to identify where our members and volunteers were coming from. And we did find the consistency with where we were going and where we thought we were going. So these two additional kinds of tools were helpful, both the SWOT analysis as well as the focus groups. I strongly recommend that you're doing something like that. It helps to get as much information in different ways as you can. We had checks and balances as we were going along too, and that was we had our entire board, as I mentioned before, as well as our committee chairs reacting as we were going along as well.
And then our strategic planning work group then took all this information and worked on continuing to refine it all into what would become our strategic goals. And we ended up with 8 different areas of emphasis, which became our plan's 8 goals. And the first one was funding. Next area was technology. We, of course, transportation is one of the main services we provide to village members, but then part of what we know in our area and that we heard from you know, our members and our other leaders during our feedback sessions was that you know, there's more transportation need than what our village was currently fulfilling in the area. So part of that goal for us is to also be an advocate in our region for additional transportation services for older adults, because we are, as Emily said, we're far away from our county seat, even though we're really the largest population or one of the 2 large population centers in our county. We're not you know, we're 25 miles away. So but we're also halfway between two other cities, Fredericksburg, Virginia, and Culpeper, Virginia. We're like halfway between them, and they have. So how can we, better serve older adults in the entire region as being an advocate for the transportation needs there? And of course, one of our other strategic goals is to maintain that focus on serving our members and also growing membership so that we can help even more of the older adults in our community, take advantage of what the village can offer, and we can help even more people live independently in their homes as they age.
And I'll go on with the fifth goal that we developed, and that is the governance, to ensure that the village is sustained with strong leadership, and eventually getting to the point where the board was focusing less on day-to-day operations and planning for where were we going, which was very consistent with our initiating the strategic plan. So we did say we need to look at the governance area. We didn't have a specific committee at the time, but that was something we knew we needed to do. And it turned out that one of the first things we did was to look at our board and have that, evaluate different aspects of the board. So that was, we got started on that part right away. Another goal was health and wellness. We wanted to be identified as a leader for improving the health of the community, especially related to older adults. So this was something where we were reaching out to all of the Lake of the Woods community rather than just our members and our volunteers, but reaching out. And that was, a couple of things that we've mentioned already as far as our goals, like the technology and the health and wellness. We didn't have committees at the time, and Yagev, our consultant, questioned particularly in the area of the technology that we didn't have a committee, but we knew it was a goal. That's something we wanted to get and advance more with, and he certainly convinced us with the different exercises we did to continue to work on the technology area, and the health and wellness area is another one that we've been working on. We'll tell you a little bit more about that later. Partnerships. I'm sure many of you realize and have used the talents of many partners in the community. We were fortunate of having 3 major hospitals in the area, and we go in different directions and will transport our members to those hospitals. We also have a community college, for example, that's in close proximity. We have an assisted living facility. So there are many potential partnerships. The partnerships that we have in the Culpeper community, which is a center part of our village, or our county, our group of 5 counties that we're grouped with. We have some wonderful resources that we're partnerships with Aging Together, and we're partners with the Regional Transportation Coalition, and we're partners with the Rappahannock Rapidan Community Services Board. So there wasn't any doubt that we wanted to build on these partnerships and increase our ability to work with them, and for both of us to leverage the benefits and to benefit the larger population in this 5-county area that we were part of. And then with the impact, evaluate and articulate the added value of village services. And it's so convincing if you can provide the data, both qualitative and quantitative data. And that's what we knew that we needed to do in order to both, to grow more and to have people recognize what we were doing as a village and how much we were contributing to our society. So the impact had several different areas, and it covered each one of our goals as to eventually, as we got into the detail of it.
So Well, now that we had goals, that's still not really a plan. That's the start of it and the outline of it. And so what we now had to work on was figuring out what we're actually going to do to accomplish and work toward achieving each of these goals. So the next step that we took was to develop core strategies underneath each goal. And I'll put up just we'll talk about just a couple examples here. Emily will walk you through the health and wellness strategies that we came up with for our plan, which are on the screen here.
Okay. We did this after Yagev let us loose. We had our goals. We finished with establishing our goals, and then it was up to us to put together the strategies that we thought we could accomplish to work on these goals, and providing access to health and wellness programs, activities, and resources, included providing access to our greater community. It wasn't just, you know, our members and volunteers, but we knew we wanted to look at some other aspects and deliver good quality programs related to health and wellness. And we worked cooperatively with agencies focused on home care and therapies. That was something here we were, you know, focused on keeping our folks at home, but realizing that they eventually were going to need some additional assistance outside of the home coming in to help them. And besides the village concept and what we were doing as a village. And so we've been working on identifying and asking people to think about the changes that may be coming and what was involved in home care. And we did quite a bit of that this past year. And then the third strategy that we put together was exploring innovative ways to address social isolation in older adults. So those were the three strategies that we came up with initially for health and wellness.
Under our technology goal, we decided on three core strategies as well. And the first one was to create a committee to investigate and help the board find ways to more effectively use technology to meet our other objectives. We also want to increase both our members and volunteers capabilities and knowledge and abilities and familiarity with using technology, and particularly with some of like Yagev had us thinking about all sorts of technology things that might be coming down the pike, like we saw with the picture with the automobile advent. But so we want to offer training and coaching for our members and volunteers in this area. And we were already doing some of that, but as we were working on this plan during the pandemic height, the height of the pandemic days, or just coming out of the height of it, if you will, telemedicine had become a lot more important than immediately, and helping some of our members access that even then, before we were, or as we were developing the plan, was something that we were thinking about. And then the other strategy under technology goal was to maximize time saving and different technologies in our own processes, like organizational administration, in fundraising, and and in our publicity and other marketing activities as well. And so these are just to give you a sense of how we came up with our others. We came up with other strategies beneath each of our 8 goals, and then that became our strategic plan. But we still now we had a plan, so what are we going to do next? And that's really the universal challenge probably for any organization, is to take a strategic plan that they've spent a lot of time and effort in developing, and then not just putting it on the shelf and letting it collect dust until you take it out next year and update it, which I know from my professional work life that happened to me once or twice in a couple of organizations that I worked for. So we were determined to try and not let that happen. We wanted to actually take action on our strategic plan and start implementing it. So we had our plan by about the middle of 2021, and we sat down again with our board and other village leaders to then go through our strategies under each goal and identify which ones we could reasonably try to accomplish or at least work on during the rest of that year. And we broke down those strategies into some specific projects or actions or efforts. And importantly, we also assigned specific leaders for those projects that we agreed we would work on for the rest of the year. And then as we approached 2022, we kind of front loaded our committee and program work plans by asking them to review the strategic plan before they develop their plans for 2022 and indicate and think about it and identify which projects, activities, and efforts supported which strategies and goals in our strategic plan. And that was really to try to make sure that we aligned our work plans with our strategic plan so that almost everything that we were doing was somehow working toward achievement of our strategic plan.
That was particularly helpful to connect our work plans with what we were planning to do the next year. And we had a mid-year review. We were actually, as we had our board meetings each month, we were going over how we were doing with our strategies and meeting the goals. And we found that it took a lot of time to do that because you're mixing your operations with your plan for the future and the things that you're doing that are creative, and it's hard to combine those together and also be efficient with your time. So we eventually went to the point where we got to a mid-year review, a mid-semester review, more or less. And that was a very timely for us because we were also bringing on additional staff members to help with that process. Primarily, we were searching for an executive director, which was able to sit in then on that mid-year review and see where we were and where we hoped to go. And from that point, we were able to, see what we could accomplish the rest of that year with our work plans. What we did with that was find that with the work plan, it would be helpful if we attached a specific strategy to the work plan. So that's what's happening right now this fall. As we go forward, the work plans will be attached with a strategy so that we will have that structure in place and the guidance in place as we're reviewing how we're doing as the plan is implemented, rather than not having a specific design for how to move forward. And as Steve said, that's what you have to struggle with all the time, is to make sure that you can implement your plan at the same time you're implementing your and conducting your operations that are necessary to keep the organization running well. So the work plans are in process now for the coming year, and we seem to be back on schedule and looking at ways to continue to track how we're doing. It was extremely helpful to have the consultant. Somebody asked in the chat session how we found them. We found that the consultant through a grant that we had, and the Catch a Fire organization that helped us match experts with a particular project we wanted to do. So that was something that was very valuable for us. And as I say, I recommend someone, a facilitator of some, depending on what your village is like and what you're looking for, that's something to talk about as to what that facilitator might be or that consultant, if it's possible for you to do that. And that's the way that you decide is you want to proceed with your strategic plan. The facilitator can be someone that's objective and is outside of himself or herself as she's directing the questions to the group. So again, we learned that it was critical to develop tools to track the implementation and record the process and recruit someone that would be the point person particularly responsible for monitoring the progress of the plan and having regular strategic plan reviews to stay on track and update the plan as necessary. We just had a session last week on updating our plan going forward, and that will be consistent with the work plans as we're developing them. It's interesting to know that we came up with a strategy session that we had last week. We decided that we really needed a committee in the technology area and a committee in the health and wellness area. So that's where we're at right here and now.
Yeah, and I got a note from Steve that we're supposed to be wrapping up our session. So again, we'll finish quickly so we can take some questions. And I know the slides are being made available. We also, in the materials that I guess are available following the session, we included a couple of the tracking documents that we had developed and used that you could adopt to your use as you see fit, just to give you some ideas of maybe some ways to track your work and activities or map them back to your plan, your strategic plan. And I know the slides are going to be available as well.
We have a couple of questions that came up in the chat discussion, and we will add our email addresses if you need to or would like to contact us with any detailed questions. Both Steve and I will include our email address.
All right, we'll do that, and they're going to close us out here in 30 seconds. So.
Thank you for joining us.
Thank you, guys. That was great. Really appreciated it.
Well, thank you.
Mm-hmm.
Thank you so much.
Yeah,
it was wonderful.
A lot of notes. Yeah.
Very good information. Thank
and done, but it's so our next presenters are I'm going to let Peter head it off. Peter Fitzgerald, who is our treasurer on the Village to Village Board of Directors, and Hillary Simmons, our vice president, are going to lead a conversation about the PACE program. So Peter, I'm going to let you go ahead, and this is being recorded, and you can go ahead and share your screen with your presentation, or Hillary, whoever wants to do it.
Great, thank you, Barbara. And I will be sharing my screen in just a minute, and I just want to start by thanking you all for this opportunity to perhaps introduce you to a program that you haven't heard before, and if it's a program that you are familiar with, perhaps lead to getting a greater and deeper acquaintance with it. As somebody who works in the PACE world, I currently am the executive vice president at the National PACE Association. And as Barbara said, Emma, who is also a real fan of the village to village model and movement. I'm very excited about the potential for these two programs to work together, given the high degree of alignment that they have between the populations that they're caring for and the mission and values that they bring to that care. So I'm going to start our presentation by telling you a little bit about PACE. It might feel like a lot about PACE, but I want to make sure before we go into a conversation about how PACE and villages might work together, that there's a shared understanding of what the PACE program is. After I do that overview of PACE, Hillary's going to offer some comments on how the PACE and Village models align in terms of, as I said earlier, people we're caring for and our goals in supporting them. And then we are fortunate to have a case study from a PACE organization operating in Charlotte, North Carolina, that is working today with the villages there in that community as well. And then we hope to have some time at the end for some audience discussion to get your thoughts on how PACE programs and villages might work together in your communities. So I think we've already heard that the speakers will be myself, Hillary Simmons. Our case study is coming from Brittany Kearney, who works at the PACE program there, and John Ryder, who is the executive director of the Charlotte Village Network. So PACE stands for Program of All-Inclusive Care for the Elderly, and it's an integrated system of care for the frail elderly that has these 4 C attributes that we like to talk about. It's community-based, meaning that care is delivered primarily in a community setting with the intent of maintaining older adults' ability to live in a community setting. It's comprehensive in that it provides any and all necessary care for an individual, and that care is viewed broadly. It could be anything from a home modification to a hospitalization, and I'll talk a little bit more about that later. But you can think of it generally as comprehensive in the sense that any benefits that are provided by the Medicare program or the Medicaid program, and any additional benefits that are specified in the care plan to meet an individual's needs are covered by either directly through direct care provision or through contracted care are covered by the PACE program. PACE is capitated, meaning that instead of getting paid on a fee-for-service basis, PACE organizations get a per person per month payment from the Medicare program or from the Medicaid program, as somebody is eligible for both of those programs. And under that capitation, it's part of what affords PACE organizations the degree of flexibility they have in terms of developing care plans and delivering services. And lastly, it's highly coordinated. It's a highly coordinated, integrated system of care so that all the different elements of care that are being provided to an individual are aware of each other and are working in concert to help that person have a high quality of life and continue to live at home for as long as possible. PACE serves people who are 55 years of age or older, and it also has a requirement that you live within a defined geographic service area that's specified by that PACE organization. And the reason for that is that PACE organizations operate PACE centers where they provide primary care activities, meals, and therapies. And they want to have a service area that is small enough that the driving time is not that great in order to get to those services. And a typical rule of thumb is we don't want to have an older adult in PACE on a van or being transported for more than about 45 minutes. Everybody who is enrolled in PACE meets their state's criteria for needing a nursing home level of care. Those vary by state, but generally states require that an individual who is going to enroll in PACE and who would have otherwise gone to a nursing home have multiple complex chronic illnesses, as well as dependencies and activities of daily living that they need assistance with. So I think the takeaway here is that people who are enrolled in PACE are not your average, relatively well older adults. They are people who are starting to have an array of complex care needs that are further intensified by the need for functional supports. But importantly, because the philosophy of the PACE care model is to help people live at home, an additional requirement to enroll in the program is that with the benefit of PACE services, at the time that an individual enrolls in the program, they would be able to live at home at that time of enrollment. If subsequent to enrollment, there's a decline in health status or other changes that might require that individual to perhaps leave their home and go into assisted living or even go into a nursing home, that is not a reason to disenroll them from PACE. They can stay in the PACE program and we can maintain continuity of care to make sure that they're getting the best care possible. Just a few kind of characteristics of the people who are enrolled in PACE. As you can imagine, the average age is higher. It's about 77. And given that we start out by trying to keep people in the community, even though everybody enrolled in the program could be in a nursing home. At any given point in time, 95% of them are able to live in the community with the benefit of services. Much like the general older population, most PACE participants are women, 69%, with 31% being men. I did want to draw your attention perhaps to the fact that even though our average age is 77, we have a fairly significant group that are in that 55 to 64 year range. So people who a little bit earlier in the aging process are experiencing this complex set of care needs enrolled in the program. And as you could imagine, again, given the frailty of the population, the PACE program is designed to serve. Most of the people we are serving have either 3 to 4 or 5 to 6 dependencies and activities of daily living. That means they need assistance doing everyday activities of life, such as dressing, bathing, transferring, toileting, eating, and walking. And these are on top of what are called instrumental activities of daily living that I know many village volunteers support one another with, such things like going grocery shopping or paying a bill or keeping the house clean. So in addition to those instrumental activities of daily living, PACE participants need assistance with these other activities. The chronic diseases that we see in the PACE enrolled population are consistent with what we see in the general older population. High prevalences of vascular disease, high prevalences of major depressive, bipolar, and paranoid disorders. We know for many older adults, particularly as their ability to get outside of the home declines, and the isolation that comes with that can bring depression, and it's a major issue for the population that we're serving. A lot of diabetes, complications, congestive heart failure, and COPD. Interestingly, about 46%, almost half of the people enrolled in PACE do have some form of dementia. So we see a lot of a high prevalence of people with Alzheimer's disease, and we are able to care for them, keeping in mind that we're able to care for them, going back to that 95% in the home, we're able to care for them and help them continue living at home safely, even as they deal with that condition. The average number of prescriptions is 6, and that reflects a real effort by the PACE program to address any polypharmacy issues. Often people will come into the program, they are seeing several different doctors at the same time. All of those doctors are prescribing medicine for them, and they're not necessarily considering the interactions or duplications. And really one of the first and best things we can do for somebody who enrolls in PACE is to address those polypharmacy issues, which reduces risks of falls and other kinds of complications. And on average, PACE participants are coming to that PACE center about 7 times a month. And while they're there, it may just be that they're coming to participate in an activity or have a meal, but they could also be going to the primary care clinic there, working with a physician, primary care provider, nurse practitioner to address their health needs, or they might be there getting some physical therapy or all of the above. Right now, there are 144 PACE organizations in the country, and many of those operate more than one PACE center. So in order to provide access to their services across the geographic area that they want to serve, they need more than one PACE center so that they are close enough to where individuals live to make those accessible. And I'm not sure it's in a later slide, so I'll just mention it now. The total enrollment in PACE programs across the country is about 62,000. So it's still a very small percentage of the number of people, which I think is generally estimated at between 10 and 12 million people in the country who need long-term services and supports. A very small percentage of those people are getting that care from PACE. PACE as a philosophy was designed to honor what frail elders want. It was actually created as a care model in the Chinese American community in San Francisco. The first program, PACE program, was called Unlock, which means peaceful, happy abode in Cantonese. And it was created by that community in order to give their elders an alternative to nursing home placement, to reflect the cultural values of that community. But I think not only that community, the values of most of us, that we want to be able to stay in familiar surroundings. We want to live with as much autonomy as possible. And we want to be able to do that safely according to the maximum possible level of our physical, social, and cognitive functioning. I would say, again, this is perhaps where I see that PACE is so resonant with the origins of the village model itself. Just to illustrate some of the creative ways that PACE organizations support their participants in ways that we really go beyond medical care. I mentioned we're providing a lot of transportation. So in addition to transportation to the center, we might provide transportation for an individual to go see a specialist or to go participate in an activity in the community. We are serving meals. We serve meals at the center as well. Home. And another favorite example of mine, if you're a dog lover like I am, we can do things like if a participant has a pet that has fleas and we know that that pet is that participant's primary daily companion, we can do things like pay to get the dog dipped and get rid of the fleas so they can continue living in harmony together and not creating any skin conditions from the flea bites of the dog. I mentioned that at the center, PACE organizations are providing therapy. So we have physical therapy, occupational therapy, recreation therapy, and speech therapy. And because we are not part of the Medicare fee-for-service system, we're not bound by the limitations of that program's coverage of PT and OT, which generally in the Medicare fee-for-service system, the coverage is only to get you back to baseline. And once you're there, that program is not going to continue to pay for PT or OT. In PACE programs, we will continue to bring you into the PTOT and really use that as a physical fitness well-being approach to making sure that you are aging successfully and able to do the things that you want to do. I said at the beginning, one of our C's is that we're a highly coordinated program. So all PACE organizations have a PACE interdisciplinary. It represents 11 different disciplines, 11 different elements of care that go into helping the person live successfully. And this team meets every single morning. They will go over any observed changes in a person's status. So perhaps if an individual is coming into the PACE center that day, and when the driver picked them up, they noticed that their walk was a little unsteady, or they seemed a little bit, not totally tracking what was going on, that driver might actually convey that to the PACE interdisciplinary team, which could trigger a conversation between the physician who might have just changed a medication and increased the dose and the physical therapist to get that person in for an assessment. And by doing that, with that high level of coordination, we're able to avoid and quickly sort of cut off a further decline in status and intervene in order to keep that person as well as possible. The funding is capitated, which is just another way of saying we get a per person per month amount. And people enrolled in PACE today are eligible for Medicare and Medicaid, so it's primarily low-income older adults. Even those who are not eligible for Medicare and Medicaid, another 9% are Medicaid only, so those are also low-income older adults. And really, it's less than 1% of the people in the program are Medicare only. And that's for various reasons, but one of those is that the program is difficult for many Medicare-only individuals to afford. I'd like to share, and hopefully the technology will bear this out. I did want to share a testimony or an interview with a family member of a PACE participant to give you a sense of what that experience was like for that individual.
I've been taking care of my mother for about 10, 12 years. She has MS and she started falling a lot and she was living alone. And I didn't want her to live alone. She didn't want to live with me, but she didn't want to live alone either. Since my mother's been in PACE, it has allowed me to work a normal 8-hour shift because the transportation that comes and pick up my mother in the morning and bring her back. The CNAs are so good with her. I'm able to do a little run around before she comes. The services that PACE provides for my mother is everything that I could ever pray and hope for. And PACE opened and accepted my mother in They provide medical service, dental service, vision service, hearing aids, whatever she needs, PACE provides. Anybody that wants to take their loved one, PACE is the way to go. I can't express to you the joy I feel now that my mother is in PACE.
To find out more about how organizations like yours can help the millions of caregivers like Cassandra, visit the PACE 2.0 website. That's pace2-o.org.
And now I'd like to turn it over to Hillary to talk a little bit about the complementary strengths of the PACE care model and the village model. Hillary?
Great. Thank you, Peter. I'm Hillary with a little help. Sorry if you can go back one. Peter, I think you're driving. All right. Thank you. So I know Peter shared a lot about some of the strengths of PACE and touched a little bit on how we might work together as a village, but we've been at a little help exploring partnership with local PACE providers and have really seen a lot of complementary strengths that have come out of that and a lot of alignment, as Peter mentioned earlier. So I really do see that PACE and villages can provide complementary support to more holistically meet our older members' needs, especially those who are needing more functional support. I mean, we all see a spectrum of ability in our older adults, and especially if folks are needing more of that support with chronic illnesses. PACE can help out in a way that villages aren't necessarily equipped to do. So villages can often help with support services and social connection, sometimes at a lower cost than PACE because we are using volunteers from the community. And PACE can provide that level of healthcare service beyond what a village and a village's volunteers can appropriately provide and would want to provide, you know, getting into bathing, toileting, some of the personal care and really looking at those ADLs rather than kind of operating at the IADL level. So on the village side, I think do a strong job, hopefully all of us I'm speaking for here, on some of our supportive services, you know, helping with transportation and yard work and handy help and, you know, the things around the home and yard that really help our older adults to age well in their homes, to be able to remain independent and with dignity in their homes, and also including that social connection with our volunteers and into the community. Some of that support for those instrumental activities of daily living really shines through with villages and intergenerational volunteers and bringing the whole community together. We also do quite a bit of resource navigation, you know, helping people find the right connections in the community if it's something that a volunteer doesn't provide. And often villages can provide some of the community-based services that PACE also provides at a lower cost by leveraging volunteers rather than staff. But on the PACE side, PACE can support an older adult far beyond what a village's capacity and capability is, because they do have those specialized staff that Peter had just mentioned. So on the care coordination side, you know, helping with chronic illness care, managing and coordinating care, and supporting transitions of care in a deeper way than some villages are able to do. They also have primary care. You know, this is not a role villages would normally take on, right? We're not healthcare providers. But to know that primary care, specialty, OT, PT, speech therapy care, support for caregivers, like the video we just saw, are real strengths for the PACE program. Both do provide transportation, and I know not every village provides transportation, but painting with a broad brush here. But PACE and villages can often get you to a healthcare appointment or to a social activity. So it's great to see some flexibility there. And honestly, I'm sure we've all seen this a bit, but I know we have. There's never too many transportation options. We typically provide 1 to 2 rides per week for our older adults, and that's that's not enough, frankly. You know, people want to access the community, and the more they're able to, you know, do the social things and get into the community in the ways that they choose, and to have that ready access for folks who aren't driving anymore is so important. And our volunteer drivers are using their own cars, so those aren't going to be accessible for folks who need wheelchair access and things like that. So a lot of great complementary and aligned strengths here. A little bit of overlap, but in a good way, which brings me to some of these opportunities to collaborate. Peter, if you'll advance, thank you. So one way to collaborate is kind of that low-hanging fruit of reciprocal referrals and marketing. You know, we are talking to a very similar group of folks. Somebody could be enrolled in a PACE program and be a village member. So that mutual referral, I think is an easy way to get started with a PACE program, to help connect village members to a PACE program if they're eligible and in need, and the same goes vice versa. And making those warm handoffs is so valuable on the member side. So it's not just, you know, a list of cold calls. So, you know, I'd advocate for getting to know your local PACE provider if you have one nearby. And I don't know if Peter will show that map again. We've zoomed in a bit here, but the other things I wanted to talk about were, you know, getting to that next level of partnership. I mentioned a bit before that often villages could provide a service that PACE might also provide at a lower cost point. So some PACE programs could be willing to partner to help make PACE members into village members, to cover some of the social pieces of care, an extra transportation unit, that kind of thing, to kind of share the care there, because PACE programs are often paying a staff person for kind of each piece that happens to a member, and villages can sometimes do that more efficiently. So one way on a revenue side is that the PACE program itself could pay a village membership for the PACE client. To get even a little bit deeper would be to actually purchase services or do a fee for service type of relationship with a village. This would require some more tracking and some more responsibility on the village's end. If you're in a PACE program's care plan, you know, you share some of that responsibility to get things done. But it's another way to bring in a creative revenue stream into a village for the activities that you're already doing. So, you know, I think there's a lot of interesting collaboration opportunities to explore between PACE and villages. And I'm excited to hear more about an actual case study of this happening. A little help is really in the ideation stages of this. We're getting to know one of our local PACE providers out on the Western Slope in Colorado, and we just launched out there, as did they. So we're all still kind of getting our ducks in capacity in a row to provide the best service we can, but we see a lot of alignment there and are looking forward to partnering in the future, whether it's in a membership way. Certainly it'll be in a cross referral way, or if we dive deeper into that purchase services piece. Peter, I don't know if you want to tee up the case study, but I'm looking forward to hearing more about how they're working together already.
Yeah, thank you, Hillary. And that's exactly what I do want to do. I want to turn it over to Brittany and John, who have been in dialogue for quite a while. When I reached out to see if we had any, you know, actual unicorns out there, PACE organizations collaborating with